New York hospitals are trying to control their image by placing gag orders on employees who share horror stories from the inside. One America's Caitlin Sinclair has more from New York.
New York City frontline healthcare workers have been pleading for face shields, masks, and other basic protective gear. Instead, hospital executives have issued them gag orders. One 62-year-old healthcare worker takes One America through her days at Harlem Hospital, where she faces chaos, threats, and fear. For this Harlem RN who requested anonymity, she says declining to be named is about life or death, for she is certain she would lose her job of 30 years.
It's true. They say that to us. You cannot talk to nobody. A lot of people know me, and if I say a detail, they're going to find out it's me, and I'm going to get fired, okay?
The coronavirus pandemic has put New York City hospitals into full battle station mode, as doctors, nurses, and other staff members treat infected patients, try to save their lives, and keep themselves from getting COVID-19.
In the morning to start the shift, I have to go, I need the isolation gown, the plastic gown. Then I have my surgical gown. Then I need to have an N95. I have to have a surgical mask. I need to have goggles. I have to have my shoes covered, but you're supposed to change your cover for the shoes every time you went to every room, but it's not happening that because they don't have enough.
When the crisis first began, staff at Harlem Hospital was told that masks had to be worn for an entire shift instead of discarding them after each patient. But now they have to wear the same mask for roughly 5 shifts.
For days, I had to wear the same N95 because they didn't have another one to give it to me.
Discouraging speaking to the press and dictating social media policies have taken place at Harlem Hospital and just about every other major New York City private hospital. One system, NYU Langone Medical Center, sent an email on March 27th warning that staff members speaking to the media without permission will be subject to disciplinary action, including termination. This Harlem nurse knows this all too well, after she watched another nurse get let go 4 months before she was set to retire. Her friend was writing to city residents through a GoFundMe page asking for help. Now, those gag orders are not limited to the systems already mentioned. In fact, at least a dozen medical professionals across various systems here in the city have shared with One America News that they signed non-disclosure agreements or contracts that stipulated they may not speak to the press without permission from their employer. Now, employees who have spoken to news outlets are pleading with residents to donate any supplies they can to their local hospitals. Caitlin Sinclair, One America News, New York.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.